Welcome to the PTCB Exam Prep. This is the PTCB Practice Test 1 to help pharmacy technicians. We have gathered 60 official questions with explained answers from the PTCB exam providers. This test will help you to prepare for your pharmacy technician certification exam. So, let's get started. Question 1. What does the abbreviation NPO mean? A. Nebulizer. B. Every other day. C. New patient only. Or D. Nothing by mouth. D. Nothing by mouth. PO is by mouth and NPO is nothing by mouth. Question 2. What is the brand name for Esopiclone? A. Ambien. B. Restoril. C. Lunesta. D. Xanax. C. Lunesta. Lunesta, Esopiclone, is a hypnotic that is used to treat insomnia. Question 3. Which of the following provides the Medicare prescription drug benefit? A. Medicare Part A. B. Medicare Part B. C. Medicare Part C. D. Medicare Part D. D. Medicare Part D. Medicare Part D is a federal government program which subsidizes the costs of prescription drugs and drug insurance premiums for Medicare recipients. This program was authorized by the Medicare Modernization Act of 2003. Question 4. Which of the following is not a Schedule I narcotic? A. Heroin. B. OxyContin. C. Ecstasy. D. Marijuana. B. OxyContin. OxyContin is a Schedule II medication. There have been numerous proposals to remove marijuana from Schedule I, but the government has declined to make this change. Question 5. This is an autoimmune disease in which the thyroid is overactive and produces excessive amounts of thyroid hormones. A. HIV or AIDS. B. Graves' disease. C. Cushing's disease. D. Addison's disease. B. Graves' disease. Graves' disease is the most common cause of hyperthyroidism. Question 6. If a physician writes an order for 400 milliliters of D5W to be infused over a 4-hour time period, and the IV drop factor is 12 drips per milliliter, how many drops per minute should be delivered? A. 1.67 drops. B. 2 drops. C. 12 drops. D. 20 drops. D. 20 drops. To solve this problem, you must first find the total number of minutes. 60 times 4 equals 240. Then find milliliters per minute. 400 divided by 240 equals 1.67 milliliters infused in 1 minute. Then multiply this by the drop factor. 1.67 times 12 equals 20 drops per minute. Question 7. Which of these herbal medications can be used to treat anxiety? A. Kava. B. Acai. C. Garlic. D. Milk thistle. A. Kava. Kava is sedating, and it is usually consumed in order to relax without disrupting mental clarity. Question 8. If 2 drugs are taken together and one of them intensifies the action of the other, what type of drug interaction has occurred? A. Antagonism. B. Potentiation. C. Synergism. D. Additive effect. B. Potentiation. Antagonism is when 2 drugs work against each other. Synergism is when the effects of 2 drugs together is greater than the sum of their individual effects. Additive effect is when the effect of 2 drugs together is equal to the sum of their individual effects. Question 9. A drug sells for $29.99 retail and has a wholesale cost of $19.74. The dispensing cost is $3.20. What is the pharmacy's net profit? A. $3.20. B. $7.05. C. $10.25. D. $29.99. B. $7.05. Gross profit is selling price minus purchase price. For net profit, you also need to subtract the dispensing cost as well. Question 10. Which of the following medications is not used to treat high cholesterol? A. Zetia. B. Crestor. C. Nexium. D. Vytorin. C. Nexium. Nexium is used to treat GERD. Question 11. What is the generic drug suffix for a proton pump inhibitor? A. Alol. B. Navir. C. Azepam. Or D. Prazole. D. Prazole. Generic proton pump inhibitors usually have the suffix prazole. Question 12. The action of reducing a material to small particles is A. Tumbling. B. Spatulation. C. Comminution. Or D. Geometric dilution. C. Comminution. There are 3 methods for comminution: trituration, pulverization by intervention, and levigation. Question 13. 74 degrees Fahrenheit is equal to what temperature in Celsius? A. 18.03. B. 23.03. C. 30.07. Or D. 74.0. B. 23.03. To convert from Fahrenheit to Celsius, subtract 32 from the Fahrenheit temperature and then divide by 1.8. Question 14. You are planning to prepare 600 milliliters of 20% dextrose solution by mixing your 5% and 50% dextrose solution. How much of each solution will be needed? A. 200 milliliters of the 50% and 400 milliliters of the 5%. B. 300 milliliters of the 50% and 100 milliliters of the 5%. C. 300 milliliters of the 50% and 300 milliliters of the 5%. Or D. 350 milliliters of the 50% and 250 milliliters of the 5%. A. 200 milliliters of the 50% and 400 milliliters of the 5%. This is an alligation problem, so you will put 50 in the upper left of your tic-tac-toe table, 5 in the lower left, and 20 in the middle. Subtracting across the middle, you will put 15 in the upper right and 30 in the lower right. So you will need 15 parts of the 50% and 30 parts of the 5% for a total of 45 parts. The amount of the 50% needed will be 15 divided by 45 times 600, which equals 200. The amount of 5% needed will be 30 divided by 45 times 600, which will equal 400. Question 15. What is DEA Form 222 used for? A. To order Schedule II medications. B. To prescribe Schedule II medications. C. To report the theft of controlled substances. D. To document the destruction of controlled substances. A. To order Schedule II medications. Form 222 is a triplicate order form for Schedule I and II controlled substances. The purchaser submits copy 1 and 2 to the supplier and keeps copy 3 on file. When the order arrives, the number of packages received must be written on the form along with the date. This form is then kept on file for at least 2 years. Question 16. This law defined 2 specific categories for medications: prescription and over-the-counter. A. Drug Listing Act of 1972. B. Kefauver-Harris Amendment. C. Durham-Humphrey Amendment. D. Federal Food, Drug, and Cosmetic Act. C. Durham-Humphrey Amendment. Until the Durham-Humphrey Amendment was passed, there was no requirement that any drug be labeled for sale by prescription only. The amendment defined prescription drugs as those unsafe for self-medication and which should therefore be used only under a doctor's supervision. Question 17. The Red Book is a resource that focuses on A. Drug pricing, B. Pharmacokinetics, C. Therapeutic equivalence evaluations, D. Labeled and unlabeled uses of medications. A. Drug pricing. The Red Book is the leading resource for information on drug pricing. Question 18. A list of medications available for use within a healthcare system is called A. Formulary, B. Perpetual inventory, C. Inventory control list, D. Pharmacy benefit program. A. Formulary. The primary function of a prescription formulary is to specify particular medications that are approved to be prescribed under a particular insurance policy. Formularies are developed by evaluating the safety, efficacy, and cost-effectiveness of various drugs. With a closed formulary, the insurance policy won't pay for drugs that are not on the list. An open formulary allows drugs that are not on the list, but will generally charge a higher copay for those drugs. Question 19. Which of the following is not used to treat insomnia? A. Ambien, B. Lunesta, C. Xanax, D. Chantix. D. Chantix. Chantix is used to treat nicotine addiction. Question 20. Tallman letters are used for which drugs? A. Have similar effects. B. Have look-alike names. C. Have more than one active form. D. Are on the DEA Schedule I drug list. B. Have look-alike names. Several studies have shown that highlighting sections of drug names using Tallman mixed case letters can help distinguish similar drug names, making them less prone to mix-ups. The Tallman letters are used to help draw attention to the dissimilarities in drug names. For instance, Celexa would be written as Celexa with capitals C, X, and A to avoid confusion with Celebrex, which has a capital C, capital B, R, E, and X. The Institute for Safe Medical Practices, ISMP, the FDA, and the Joint Commission promote the use of Tallman letters as one method of reducing confusion between similar drug names. Question 21. What is the brand name for aripiprazole? A. Abilify, B. Ativan, C. Zyprexa, D. Cymbalta. A. Abilify. Abilify, or aripiprazole, is an antipsychotic. Question 22. The pharmacy technician notices that a dosage may be typed wrong in the system. The reading says 0.1 grams, but it should probably be 0.01 grams, as 0.1 grams may be too large of a dose. What should the technician do in this case? A. Ask the patient. B. Alert the pharmacist to verify. C. Go ahead and change the dose. D. Call and ask the physician if it is the correct dose. B. Alert the pharmacist to verify. They should alert the pharmacist. The other choices are beyond the scope of the pharmacy technician. Question 23. A drug is recalled by the FDA, but the problem is unlikely to cause any adverse health reactions. What type of recall would this be? A. Class 1. B. Class 2. C. Class 3. Or D. Class 4. C. Class 3. Class 1 recalls are the most serious type. Class 2 recalls are for less serious problems, such as temporary adverse health consequences. Class 3 recalls are for situations in which adverse health consequences are unlikely. Question 24. According to federal law, DEA forms need to be maintained for how many years? A. 1. B. 2. C. 5. D. 7. B. 2 years. These regulations are issued by the Drug Enforcement Agency, which is an agency of the U.S. Department of Justice. Question 25. Laminar flow hoods must be certified every how many months? A. 3. B. 6. C. 12. Or D. 24. B. 6. Laminar flow hoods are used to remove contaminants and provide clean air to the working area. Question 26. Convert 5.5 kilograms to pounds. A. 0.55 pounds. B. 1.21 pounds. C. 12.1 pounds. Or D. 55 pounds. C. 12.1 pounds. Recall that a kilogram is equal to 2.2 pounds, and 5.5 times 2.2 equals 12.1. Question 27. What type of drug is loratadine? A. Antitussive. B. Antihistamine. C. Expectorant. D. Decongestant. B. Antihistamine. Antihistamines are commonly used to relieve allergies. Question 28. An order is written to administer 2 liters of an IV fluid over 18 hours. What will the flow rate be? A. 56 milliliters per hour. B. 83 milliliters per hour. C. 101 milliliters per hour. Or D. 111 milliliters per hour. D. 111 milliliters per hour. Divide the volume by the time to get the flow rate. 2 liters equals 2,000 milliliters. 2,000 divided by 18 equals 111.1 milliliters per hour. Question 29. The percent equivalent of a 1 to 125 ratio is A. 0.8%, B. 0.08%, C. 8.0%, D. 12.5%. A. 0.8%. Percent means parts per hundred. 1 divided by 25 equals x divided by 100. Cross multiply. 125x equals 100. X equals 0.8. Question 30. If a drug has no accepted medical use and extremely high potential for abuse, which DEA schedule would it be categorized in? A. Schedule 1. B. Schedule 2. C. Schedule 3. Or D. Schedule 4. A. Schedule 1. Schedule 1 includes drugs such as marijuana, ecstasy, peyote, and heroin. Question 31. An order is written for 500 milliliters of NS to infuse at 40 drips per minute. How long would it take to infuse the NS if the set delivers 10 drops per milliliter? A. 40 minutes. B. 50 minutes. C. 100 minutes. D. 125 minutes. D. 125 minutes. 10 GTT by ml means 10 drops per milliliter. So, for 500 milliliters, you will get 10 times 500 equals 5,000 drops. The flow rate is 10 drips per minute, which means 40 drops per minute. So, divide the total drops by 40 to get the number of minutes. 5,000 divided by 40 equals 125. Question 32. What is a common side effect of warfarin? A. Headache. B. Diarrhea. C. Internal bleeding. D. Difficulty breathing. C. Internal bleeding. Warfarin is an anticoagulant. It is used to prevent the formation of blood clots. The only common side effect is hemorrhage, bleeding. Question 33. On which of these would you find information about the pharmacology of a drug? A. PPI. B. Prescription. C. Prescription label. D. Auxiliary label. A. PPI. A PPI, or Patient Package Insert, is a document provided along with a prescription medication to provide additional information about that drug. The first section lists the brand name and generic name of the product. The other sections cover clinical pharmacology, indications, contraindications, warnings, precautions, adverse reactions, drug abuse and dependence, overdosage, dosage and administration, and how supplied. The clinical pharmacology section tells how the medicine works in the body, how it is absorbed and eliminated, and what its effects are likely to be at various concentrations. Question 34. This federal law requires pharmacists to review Medicaid recipients' entire drug profile before filing their prescriptions. A. Medicaid Tamper-Resistant Prescription Act. B. Prescription Drug Marketing Act of 1987. C. Omnibus Budget Reconciliation Act of 1987. D. Omnibus Budget Reconciliation Act of 1990. D. Omnibus Budget Reconciliation Act of 1990. OBRA 90, or OBRA 90, placed regulations on the pharmacist in how to interact with the patient, with the goal of improving therapeutic outcomes. The law includes prospective drug utilization review, or PRODR, requirements, counseling obligations, and record-keeping mandates. Question 35. Schedule II medications must be stored in A. A refrigerator. B. A locked safe. C. A laminar hood. D. The DEA cabinet. B. A locked safe. All Schedule II substances should be stored in a locked safe, while Schedule III, IV, and V may be stored throughout the pharmacy. Question 36. What is the proper hand-washing guideline in USP 797? A. Wash hands and wrists for at least 20 seconds. B. Wash hands and wrists for at least 30 seconds. C. Wash hands and forearms to the elbow for at least 20 seconds. D. Wash hands and forearms to the elbow for at least 30 seconds. D. Wash hands and forearms to the elbow for at least 30 seconds. USP 797, or the hand hygiene procedure, says this. 1. Remove debris under fingernails with nail cleaner and warm water. 2. Wash hands and forearms to the elbow for at least 30 seconds with soap and water. Be vigorous and thorough. 3. Do not use antimicrobial scrub brushes on the skin because they can damage the skin and increase skin shedding. 4. Dry hands and forearms completely using lint-free disposable wipes or an electric hand dryer. Question 37. What is DEA Form 41 used for? A. To order Schedule II drugs. B. To report the theft of controlled substances. C. To report the inventory levels of controlled substances. D. To document the destruction of controlled substances. D. To document the destruction of controlled substances. The purpose of DEA Form 41 is to document the surrender of controlled substances that have been forwarded to the DEA for disposal. Question 38. Which of the following is a non-prescription medication used to treat insomnia? A. Melatonin. B. Zolpidem. C. Temazepam. D. Glucosamine. A. Melatonin. Glucosamine is a non-prescription medication used to treat arthritis symptoms. Zolpidem and temazepam are prescription medications used to treat insomnia. Question 39. What type of drug is omeprazole? A. Diuretic. B. Beta blocker. C. ACE inhibitor. Or D. Proton pump inhibitor. D. Proton pump inhibitor. Prilosec, or omeprazole, is a proton pump inhibitor that is used to treat gastroesophageal reflux disease. Question 40. What is the maximum capacity for a Class A balance? A. 1 kilogram. B. 6 kilograms. C. 100 kilograms. Or D. 120 kilograms. D. 120 kilograms. The minimum weight that can be weighed on a Class A prescription balance is 120 milligrams, and the maximum weight is 120 grams. The sensitivity is 6 milligrams, meaning that 6 milligrams of a substance will move the pointer of the balance 1 division off equilibrium, or 1 degree. Question 41. Which of the following is not a medication for Parkinson's? A. Amlodipine. B. Ropinirole. C. Benztropine. D. Amantadine. A. Amlodipine. Norvasc, or amlodipine, is a calcium channel blocker that is used to lower blood pressure and prevent chest pain. Question 42. Which of these is an antihistamine? A. Losartan. B. Lisinopril. C. Fluconazole. D. Fexofenadine. D. Fexofenadine. Fexofenadine is an antihistamine with the brand name Allegra. Lisinopril is an ACE inhibitor. Losartan is an angiotensin II receptor antagonist. Fluconazole is an antifungal. Question 43. Which act of Congress addresses the privacy and security of health data? A. Americans with Disabilities Act of 1990. B. Occupational Safety and Health Act of 1970. C. Omnibus Budget Reconciliation Act of 1990. Or D. Health Insurance Portability and Accountability Act of 1996. D. Health Insurance Portability and Accountability Act of 1996. The HIPAA privacy rule provides federal protections for personal health information and gives patients an array of rights with respect to that information. Question 44. Which statement is true of PPO plans? A. PPO plans usually have lower premiums than HMO plans. B. PPO members are not reimbursed for using medical care providers outside of their network of designated doctors and hospitals. C. PPO memberships provide a substantial discount below the regular rates of the medical professionals who are in the network. D. PPO plans often require members to select a primary care physician who acts as a gatekeeper to direct access to medical services. C. PPO membership provides a substantial discount below the regular rates of the medical professionals who are in the network. PPO plans provide substantial discounts for doctors and hospitals in the network. When using out-of-network providers, PPO members are reimbursed at a reduced rate. With a PPO, members can see the doctor or specialist they like without having to see a PCP first. PPO premiums tend to be higher than HMO plans, and there is usually a deductible. Question 45. Which of the following correctly matches the brand to the generic name? A. Ativan, Levaquin. B. Cymbalta, duloxetine. C. Paxil, pregabalin. D. Zyrtec, diphenhydramine. B. Cymbalta, duloxetine. The generic name for Cymbalta is duloxetine. The generic name for Paxil is paroxetine. The generic name for Zyrtec is cetirizine. The generic name for Ativan is lorazepam. Question 46. Which is the proper use of Tallman letters to help differentiate these look-alike, sound-alike medications? We'll be looking at paroxetine and fluoxetine. A. Capitalize the first 5 letters of each of them. B. Capitalize the oxetine part of each of them. C. Capitalize the par and flu in each of them. Or D. Capitalize the teen in both of them. C. capitalize the par and flu in each respective one. With tallman letters, you capitalize the part of the drug name that is different. Question 47. The FDA publishes a book called Approved Drug Products with Therapeutic Equivalence Evaluations, which is more commonly known as A. The Red Book, B. The Orange Book, C. Remington, D. Martindale. B. The Orange Book. The Orange Book identifies drug products approved on the basis of safety and effectiveness by the FDA. It also contains therapeutic equivalence evaluations for generic drugs, using therapeutic equivalence codes such as AA, AB, BC, and BD. If the first letter of the code is an A, the FDA has concluded that the generic formulation is therapeutically equivalent to the reference drug. If the first letter is a B, the FDA has concluded that the compared drugs are not equivalent. The second letter of the code gives more detailed information about formulations. The Orange Book also lists the patents which are purported to protect each drug. Question 48. Which part of the NDC number indicates the manufacturer of a drug? A. The product code. B. The last 1 to 2 digits. C. The first 4 to 5 digits. D. The second segment. C. The first 4 to 5 digits. The labeler code is the first segment. It is 4 to 5 digits and identifies the manufacturer. The product code is the second segment and is 3 to 4 digits long. It identifies the formulation, strength, and dosage. The package code is the third segment. It is 1 to 2 digits and identifies the package forms and size. Question 49. How much dextrose is in a 900 milliliter solution of D5W? A. 45 grams. B. 90 grams. C. 180 grams. D. 500 grams. A. 45 grams. D5W means 5% dextrose in the solution. Calculate 5% of 900 and you'll get 45 grams. Question 50. Which of the following is not a diuretic? A. Maxide. B. Furosemide. C. Pioglitazone. D. Spironolactone. C. Pioglitazone. Pioglitazone is a hypoglycemic agent. Question 51. The iPledge program is designed to mitigate the risks associated with taking A. Lexapro. B. Zolpidem. C. OxyContin. D. Isotretinoin. D. Isotretinoin. Isotretinoin is a medication primarily used to treat cystic acne. Common brands include Absorica, Accutane, Amnesteem, Clarivis, Epuris, Isotroin, and Roaccutane. iPledge is a mandatory distribution program that is intended to prevent the use of isotretinoin during pregnancy due to the high risk of birth defects. Question 52. Which of the following covers inpatient hospital stays? A. Medicare Part A. B. Medicare Part B. C. Medicare Part C. D. Medicare Part D. A. Medicare Part A. Medicare Part A covers inpatient hospital stays, including a semi-private room, food, and tests. The maximum length of stay that will be covered is usually 90 days. Question 53. A prescription calls for 25 milligrams of medication, TID, for 7 days. The stock solution is composed of 100 milligrams per 3 milliliters. How many liters of the stock solution is needed for the order? A. 0.1575. B. 0.01575. C. 12.50. D. 15.75. B. 0.01575. The abbreviation TID means 3 times a day. So 7 days times 3 times per day times 25 milligrams each equals 525 milligrams total needed. 100 divided by 3 equals 525 divided by x. Cross-multiply to solve for x. 100x equals 1,575. X equals 15.75 milliliters. The answer asks for liters, so divide by 1,000. 15.75 divided by 1,000 equals 0.01575 liters. Question 54. The process by which a health insurance company determines if it should be the primary or secondary payer of medical claims for a patient who has coverage from more than one health insurance policy. A. Prior authorization. B. Workers' compensation. C. Coordination of benefits. D. Pharmacy claim transmittal. C. Coordination of benefits. Coordination of benefits is important when a patient is covered by more than one insurance plan. Medicare is often one of the plans involved with COB. Question 55. How many digits is in a BIN number? A. 4. B. 5. C. 6. D. 11. C. 6. The NCPDP Processor ID number, or BIN, is a 6-digit number that health plans can use to process electronic pharmacy claims if they do not use pharmacy benefit cards with a magnetic stripe. Plans that use cards with a magnetic stripe should use the recommended American National Standards Institute, or ANSI, Issue Identifier Number, or IIN, for processing electronic pharmacy claims. ANSI issues IIN numbers. NCPDP issues the processor ID numbers, or the BIN. Question 56. What is DEA Form 106 used for? A. Ordering Schedule II medications. B. Disposal of controlled substances. C. Theft or loss of controlled substances. D. Reporting inventory levels of controlled substances. C. Theft or loss of controlled substances. Written notification must be provided to the DEA Field Division Office of the theft or significant loss of any controlled substance within 1 business day of discovery of the loss. DEA Form 106 must be completed and submitted to the Field Division Office. Question 57. Which of the following potential hazards are addressed by OSHA regulations? A. Exposure to hazardous chemicals. B. Exposure to blood-borne pathogens. C. Exposure to wet surfaces and potential slips and falls. D. All of these potential hazards are addressed by OSHA regulations. D. All of these potential hazards are addressed by OSHA regulations. OSHA regulations address the following potential hazards in a pharmacy: exposure to blood-borne pathogens like HIV, hepatitis B and C, exposure to hazardous chemicals or drugs, exposure of eyes or bodies to corrosive materials, exposure to latex allergy, exposure to wet surfaces that could cause slips and falls, and availability of personal protective equipment. Question 58. Which federal law introduced a proof of efficacy requirement? A. Pure Food and Drug Act. B. Kefauver-Harris Amendment. C. Durham-Humphrey Amendment. D. Comprehensive Drug Abuse Prevention and Control Act of 1970. B. Kefauver-Harris Amendment. The Kefauver-Harris Amendment is also known as the Drug Efficacy Amendment. It is a 1962 amendment to the Federal Food, Drug, and Cosmetic Act. It introduced requirements for drug manufacturers to provide proof of effectiveness and safety of their drugs before they could be approved. It also required drug advertising to disclose accurate information about the side effects and efficacy of treatments. Question 59. Individuals with a severe allergy to penicillin should not receive A. Amoxicillin. B. ciprofloxacin, C. doxycycline, D. azithromycin. A. Amoxicillin. Amoxicillin is contraindicated and should be avoided, while other options given here are considered safe. Other antibiotics to avoid include augmentin, flucloxacillin, penicillin G, penicillin V, tazocin, temacillin, and tementin. Other drugs that are on the caution list and should also be avoided include all cephalosporins, cephalexin, cefixime, cefotaxime, ceftazidime, ceftriaxone, cefurazime, and all carbapenems, ertapenem, imipenem, and cilastatin, meropenem, and aztreonam. Question 60. Barcode Medication Administration, or BCMA, is a system designed to A. Manage controlled substances, B. Fill prescriptions more accurately, C. Monitor medication adherence rates, D. Prevent medication errors in healthcare settings. D. Prevent medication errors in healthcare settings. The BCMA system is used by nurses and healthcare settings who are administering medications. With this system, the nurse can scan a barcode on the patient's wristband to make sure it is the right patient. Then, the nurse scans a barcode on the medication to ensure it is the right medicine, the right dose, the right time, and is administered by the right route. If you like these videos, then please like, share, and subscribe to our channel for more videos. And don't forget to share it with your family and friends.